Welcome everybody to GoLocal Live. I'm Josh Fenton, CEO and co-founder. A couple quick pieces of news and a little bit of scheduling. Obviously last night the Democrats formally endorsed Joe Biden as their candidate for President of the United States. That video, if you haven't seen it, is up on GoLocal. You can watch that anytime. Rhode Island, specifically Providence, has been racked with murders. This is the 5th murder last night that's taken place in the last 2 weeks on an almost record pace for the number of deaths. This is also the 9th death since the end of June. So in just 2 months, 9 murders here in Providence. The mayor is having a press conference at 11:30. We'll have coverage of that as well. On a scheduling note, we're going to go, just after we go to Bolzano, Italy, we're going to go down to the University of Virginia and talk to the chair of the political science department, Jennifer Lawless, get her take on what took place at the Democratic convention. And then at 12 noon, we'll have Dr. Michael Fine. Let's go to Bolzano, Italy. Rebecca Couto da Silva, thank you so much for joining us.
Thanks so much for having me.
So Rebecca, I think for about a month or two, maybe 6 weeks, things in Italy were going very well. Things were reopening on a steady pace, but the last couple weeks have gotten shaky. And then yesterday was a record number of new cases of coronavirus, the most number of cases since the lockdown, and over 800 cases. Talk a little bit about what's going on in Italy.
Yeah, there's some debate about whether it's just that there's an increase in testing. I believe they might have started doing some testing in Malpensa. So the percent might be the same. I've seen that, but I don't know if it's from a reliable source. There's a lot of, denialism going around. So I have seen a couple people saying, no, slow down. It's just that the testing is up, and they're, of course, I think just looking at the raw number, of course, though, it's pretty shocking from a public policy standpoint. But it's not surprising. I think for a couple of weeks, I've been saying that I've been observing a lot of behavior of people feeling very relaxed about the virus. So if it does represent a real uptick, then, it reflects also the fact that I think that there's been a bit of a relaxation of practices. We actually, right after, 2-3 hours after we spoke last week, Italy came out with a new mask mandate. Oh no, sorry, a couple days after. They came out with a new mask mandate, which is basically from 6 p.m. to 6 a.m. If you're in a place where a crowd could gather, then you have to wear a mask.
Talk about your region. You're up in Bolzano in the northwestern corner of Italy on the Austrian border. Has the number of cases in that region increased as well?
Yeah, we've been in low single digits, and our testing has been, I think, between like 600 and 1,200 a day. And we've been low singles, low singles, low singles. Yesterday was 21. And so that's a pretty shocking number. In terms, I know it's probably nothing for the United States, but when you are at 2, 3, 5, and when your big day is like 7 or 9, to just have it be 21 all of a sudden, it's a pretty high number. And I don't think that particular number is attributable to testing going up. So we got a big jump yesterday. Our numbers come out at 6 p.m. here, 6 to 6:15. So we'll get more numbers today. And we'll see what happens in terms of the public policy to follow these numbers, if yesterday was a glitch or if it's the beginning of a trend.
You're about 2 weeks or so before school's scheduled to start. You're in, quote, the yellow zone, meaning schools are scheduled to go back. What would trigger the yellow zone, the yellow code, to go to red and force at-home distant learning?
So right now, the Minister of Education has said, no, we are going to be in school. But I believe that the work unions are giving some pushback on that, given these new numbers. It's all very new because these numbers from yesterday are very new. Something I think nobody wanted, but if you were actually looking around at how things were going, you would definitely expect it. I I expect us to go back to school. Um, and then I expect that we'll go back to school. We're about a week before the rest of the country, so we'll go back on the 7th. I think that it's usually the 5th, but the 5th is a Saturday, or it's usually the 6th. But we're going back on the 7th. I think the rest of Italy the 15th, and I think that our region will start in class, and then we'll see how it goes. Of course, I've got 2 weeks of numbers that we don't know what those are yet. So if those all go like today, it could be that the country decides to red zone everybody.
Um, During this period of time, getting these higher numbers, do you think that's going to shake up the population in Italy, that people will get more regimented, get back to that sort of tougher, more adherence to mask wearing and social distancing as they did in the lockdown and just coming out of the lockdown? Or do you think the fun of the summer has created behavior that you're just not going to correct that?
Yeah, I think that for example, this new mandate to wear masks from 6 p.m. to 6 a.m., it's pretty clearly aimed at young people. It was all the same mandate closed all nightclubs across the country. So, and the positives are in a younger population. So I do think that there is a lot of this is just it's spreading among younger people who don't necessarily feel the symptoms in the same way, and are just kind of, they've been locked up since March, and it's it's been hot for a lot of people for a long time to be cooped up in the house. I am definitely concerned because there's a strain of thought going around that it's mutated, it's not so dangerous, and I just don't necessarily see that. What we're seeing is infection in younger people. We're seeing infection in a time that people are a little bit, not dealing with other colds and have more vitamin D, perhaps, where we might be hardier. And so the fact that we've got higher infections and it's not laying people out in the hospital could be due to a number of factors that will change when mixed age groups all go inside in a couple weeks.
Yeah, listen, this disease knows no limitations based on age. As we were talking beforehand, a member of the GoLocal team, that individual's spouse had COVID, seemed to be on the recovery, 31, 32 years old, and that individual ended up back in the hospital this past week. So perfectly healthy, no underlying health issues, in good shape, all those things. So, I think there's this perception that if you're not 70 or 80, you're good to go. It might feel bad for a couple weeks, but that's not the case. This is a very, very tough virus for some people, and you don't know who it's going to be tough for and who you don't. I mean, that's the reality of it. Is there a sense at the governmental level, at the top tier of the federal government there in Italy, that this is serious, that we really need to buckle down, change course, or we're going to end up like we were in March, where literally hundreds were dying by the day?
Yeah, there is definitely that sense, and there's also an election, and the people voting are pretty tired of being told what to do. Um, and so I think that Conte has always sort of he's put his neck on the line in terms of doing things that people don't like. And I think that is to be respected. I think Italy's numbers, as you can see, we had this mountain peak and then they went down and they stayed down until now. So we do have someone who has always been willing to take this very seriously. Speranza also is the health minister, and he's the one who basically put out these measures. We had a big holiday on August 15th, and I mean, you could hear the parties. You could hear, we were at home, but you could hear people, large groups of people talking. And it was, I believe, the next day or the next Monday that these new orders came out. And these guys are taking it seriously. That said, there's an election coming up. And, I'm not sure. I'm certain the election is local, but party's a party. So I think that I think there's some conflict, but I do believe that the central federal government in Italy is willing to take this seriously when the numbers take it seriously. I'm actually afraid of getting put on lockdown again before I go to renew my residence permit, which would just be kind of disastrous if they put us on lockdown and don't give us immigrants another extension.